Hi, I'm Dr. Miller.
Hi.
Hi, Dr. Miller.
Nice to meet you guys. So before we begin, I just wanted to know what brings you guys here.
Well, my other doctor referred me to you. I wanted to come talk to you about how we want to start a family.
Okay.
And what some of our options are.
Excellent. Well, congratulations on that decision, and thanks for coming to see us. We're excited to be involved. Now, before we kind of delve into how to start a family, are there particular questions or concerns that you guys have? I want to make sure I address all of those in our visit.
I just want to know what our options are, and I've heard about PrEP, so I'm wondering if that's an option for me.
Okay, Ted, do you have specific
I
concerns?
just want to know everything we can do.
Everything you can do. Okay, excellent. So I think, we'll kind of start broad picture. When we think about starting to have a family, there's a lot of ways to start a family. There's kind of a biologic way to start a family, traditional way to start a family. There's adoption. There's using other sperm or eggs from donors to potentially start a family. And I think when we think about a family, we want to think about all of these options, both in terms of risk and what might be accessible.
I think we really would like to have a baby, like a biological baby of our own.
Okay. So let's talk a little bit about that. I think there's a spectrum of how that can be achieved and be achieved in a safe way. So I'm glad you guys are here. You're already a step ahead of the game. So in terms of how to achieve a biologic pregnancy, what we need to think about is reducing your exposure to the HIV virus. So how we do that I kind of break it down into categories. So a way I would not recommend would just be to have unprotected intercourse whenever you not be on medications, your viral load be high. That would put you at a very high risk of contracting the HIV virus. And if you were to contract the HIV virus, that would put the pregnancy at risk of transmission. So definitely something that I would say off the table. So Ted, are you currently taking medications?
I am, yeah.
Excellent. And how long have you been on your current regimen?
My current regimen was switched over about 6 months ago.
6 months ago. And what are you taking specifically?
Triamic.
Triamic, okay. And over these past 6 months, how has your viral load been?
It's been undetectable from before and during.
Okay, excellent. That's fantastic. So I think you're already a step ahead by you achieving viral suppression, by not having any virus detectable in your blood. We've already reduced the risk of transmission to Poppy by 96%. So that's fantastic.
So if it's already that low, how does PrEP improve on that?
That's a really great question. So I'd say two reasons. One is that even though you're virally suppressed and we have this 96% reduction, there's still some residual risk or some risk that's still there of transmission. The other part is that even though we know the virus isn't detectable when we've tested in your bloodstream, there could be virus that is detectable at certain points, blips in your viral load, or virus that's detectable in genital secretions that we aren't detecting in the bloodstream. So by giving you PrEP during the time or around the time of exposure would protect your body in case it encounters the virus from being infected with the virus.
Do you know about how much?
And so the studies overall on people that are using PrEP show that, again, in an already low-risk situation where the risk of transmission is low because you're virally suppressed, we can reduce it even further by an additional 70%.
Oh.
Now, for people who are taking the medication every day, so in the studies where we've tested and said they're absolutely taking the medicine every day, it's 95% reduction. So again, we're talking about already reducing it by 96%, and then on top of that, reducing it a further 95%. So while we can't get the risk to zero, we can get it pretty darn close.
Okay.
The way PrEP works, it's a pill, Truvada, so it's a once-a-day combination medication. You would start it 1 month before trying to conceive. We would talk about tracking your cycles, seeing if they're regular, and then timing ovulation. And then at the time of ovulation, your maximum fertility period is when you would have unprotected intercourse just that day and the next day. That's your highest fertile period, so we want to make sure we're concentrating any exposure on a time where pregnancy is most likely to be achieved.
Okay.
You would continue taking PrEP until you found out you were pregnant, we would then talk about, you would continue it for at least a month after the last unprotected intercourse. And then we would talk about whether it's the pros and cons of continuing PrEP during the pregnancy or not. Okay.
Are there any side effects?
That's a wonderful question. So Truvada is a really well-tolerated medication. Some side effects include a headache, is probably the most common that I've heard of, but we would be checking in every 3 months to do pregnancy testing, to do STI testing, to do HIV testing on you. And then of course we want you to continue going to your doctor, and we would want to get a couple extra labs just to be sure that we're safe.
For sure.
So that's option number 1, which is PrEP. The advantages of it are that it's accessible, we can start it, and it allows you guys to kind of get going. The disadvantage of PrEP is there's some residual risk that's still there, right? We've already talked about the viral load reduction being so profound in terms of reducing risk, PrEP reducing that even further, but we know there is still some risk of transmission. So that brings us to using what we call alternative insemination, or artificial reproductive technologies. So what these include are taking a sperm sample from you and remembering that the semen itself, the part that's important in getting pregnant, doesn't have the HIV virus within it. It's actually the white blood cells around it that have the HIV virus. And so what we can do is take that sample, wash it down, and isolate the sperm, and be able to inject those sperm into you. And we can test the sperm before we inject them and make sure we don't see any detectable virus. This is something that there's cases that are reported. Roughly 700, 800 have come out of Italy. There's been no cases of transmission because we're able to detect, again, isolate those sperm and make sure there's no HIV virus there. That doesn't mean there's zero risk. The sample size is pretty low. There could be some small risk, but we do know that it's very low. The disadvantage of that option,
Expensive.
yeah, as you can imagine, it's very expensive, and in fact, it can be difficult to access. I can tell you in this city, there's no labs that do the sperm washing and HIV testing, so we would have to refer you to travel elsewhere.
So how do we get started with PrEP?
Oh, we could start that today. So what I'd want to do is, if it's okay with you, get records from your doctor, make sure we have your most up-to-date viral load. We'd also get other STI screening from you. For you, we'd do baseline STI screening. We can do that today. We'd also want to test your renal function and check to see if you've ever been exposed to any hepatitis, because those would give us caution with wanting to give you Truvada. But we could do that absolutely all here today. We'd go over how to track your cycles, and then we can get the prescription in once we have both of your lab work completed.
Great.
So we've been tested for STIs, so I'm just trying to figure out why we're being tested again. I mean,
Yeah.
we've done that already.
Right,
That's
so
something-
excellent question. So I consider STI testing for both partners a really critical part of the PrEP program. And again, the reason is even though your viral load isn't detectable in the bloodstream, if there was any infection in the genital tract, it could increase the amount of virus that's there. And so what we want to do, our goal here is to reduce the risk as low as possible. And a part of that is screening and just being absolutely sure that nothing is present.
So just the biggest concern is to be able to have a baby that's going to be HIV negative and to not transmit it to Poppy also.
Absolutely. So I think we've talked a lot about risk of transmission to you, and I think that's critical because by preventing you from getting infected, we're 100% preventing the baby from being infected.
I like that.